Hello, this is Dr. Raul Vazquez. I wanted to kind of give you guys the good news. So the health homes were evaluated by the state, and so these performance measures came out. And what you can see there is a G-Bon, when we first got into this game back in 2012, now we're 2015, the average primary care visit per enrollee, which is what they want you to do, was here. We actually did better than the other health homes, and we were almost as good as the other state averages. For a process that just began, I thought we did a fairly good job. When you look at the average primary care visit per health home member, you're looking at the state average, which is where they want you to be. And again, G-Bon outperformed it. It was in the 3.54 region. And so the patients that are coming in are, what are they coming in for? And so you saw that they're acutely ill. They've got people with triple chronic diseases, catastrophic illnesses, malignancies. So the members that we were dealing with were actually sick in terms of more chronic diseases. HIV was also high up on the list. When you look at the ER enrollment, when we first came into the game, these were patients that were assigned to our system, so we hadn't had connections. Other systems like Spectrum had a migration of their people over, so that became easier. For us, it took us about a year to really kind of stabilize that market. But after we did that, if you look at the ER, we came down and we're lower than the other two with a higher volume. So our volume is much higher at this stage. When you look at average inpatient admissions per enrollment from the 2012 to the 2015, again, during that same timeline when we got these patients, there was a lot of inpatient admissions. The other spectrum didn't have as many, but now we came down and we're actually lower than all three health homes. So we've actually, our systems have been shown to kind of work in terms of the care coordination model. When you look at the enrollment models, Lakeshore is here, Health Spectrum is here, and you see that G-Bon has actually grown. We did more of a bottom-up recruitment, so we're more involved in the community with our care managers, so there's a lot more recruitment, and that's where most of the growth that you see from Erie County came from G-Bon. When you look at the distribution models, so we had members assigned to the health home. Spectrum, our health home partners, got most of those assignments. Lakeshore got less, and we got a smaller amount. But what was interesting was in terms of members that were engaged in outreach, our ratio was much better than the other homes. And also the ones in terms of the conversion to an enroll, our ratios were better.